Hi, my name is Scott Luhmann. I'm from St. Louis, Missouri, and I'm going to be talking about growth guidance systems. Growth guidance systems were first presented by Eduardo Luhmann many years ago, where he used rods with sublaminar wires, and what he did was not to perform fusions, but to create a track and trolley system with the use of sublaminar wires. Current growth guidance systems use pedicle screws, which is different than what was originally described. The treatment with growth guidance systems involves use of pedicle screws at the apex of the deformity to maximally correct the apex deformity and fuse it in place. Screws which are placed above and below instead of sublaminar wires rigidly grip the spine but allow the screws to glide along the rods as the child grows. This permits vertical growth, and it is the child's vertical growth capacity which provides the growth over time, and it is the engine that pushes the screws along the rods during the child's growth. The device does not need more than one surgery in a planned fashion, unlike traditional growing rods or magic systems. Traditional growing rods would use approximately every 6 months lengthening in the operating room to lengthen the construct. Magic devices, which would be lengthened in the office, approximately every 1 to 6 months, depending upon the surgeon's preference. In a recent publication, he showed that most of these growth guidance systems undergo a total of 3 surgeries during their treatment. The first one would be for implantation of the growth guidance system. The second one would be if the rods would happen to break or if the screws grow off of the system. And the third would be for definitive treatment, which would be most commonly conversion to a definitive fusion surgery with further correction of the deformity or complete implant removal. At present, in the United States, there is only one system which is FDA approved for this growth guidance system.